For more on this, I want to bring in Dr. Ayisha Kurji. She's a pediatrician and an assistant professor at the University of Saskatchewan College of Medicine. So, Dr. Kurji, as we heard from Dr. Shahab, Saskatchewan is first in Canada in terms of the rate of active COVID cases. And yet, even though Saskatchewan is first, higher than Ontario, Ontario has a stay-at-home order. In Saskatchewan, you can still go out to a restaurant and you can still kind of go about your business?
That's correct, yes.
What do you think of that?
I think we know we need to do more. I think we should know that we need to do more. And listening to Dr. Shahab today, if you watch the modeling, it sounds like even if we were to keep our same measures in place, we're not going to be able to decrease the cases. We're only going to, if we're lucky, be able to manage and keep things as status quo, which is not enough, right? So I think it's pretty clear that we need more in place than we have right now.
So why is that not happening? Why is more not, again, it's the most, so it's per capita, right? The highest rate in the country right now is in Saskatchewan. We're talking a lot about Ontario because it is a big populous province and there's a stay-at-home order, but Saskatchewan is the place where the most per 100,000. So why is more not happening?
That's a good question. I don't know. I mean, Dr. Shahab said today that we'll be watching the cases closely this week. And if things continue where they're at, then they would need to reassess next week whether or not we need more measures. But I think we need more now.
I mean, that's the issue, right, Dr. Kurji? It seems as though many times in this pandemic we have seen the political leaders who make the final decisions on all of this. It's physicians like yourself. I know you're not on the, you don't work for the province, but it's physicians who provide the recommendations, and then the political leaders, the premiers of this country, they make the decisions, and it seems time and time again, they make these strict decisions after it's almost too late when the healthcare system is right on the brink. Why is this happening over and over and over again? It's like a bad movie.
It really is, isn't it? I think they have lots to weigh, right? They have to think about the economic impact as well as the health impact. But I think it's become very clear that the faster we react, the more we are able to clamp down on the cases and keep things for the healthcare at a place where we can manage, and then hopefully be able to keep our economy going as well, right? But it's hard to keep your economy going when everyone is having to be locked down and people are in the hospital and we're having to put more and more into the hospital. I think you're right. It seems pretty clear that the faster we react, the more likely we are to have success.
I mean, I don't know. I'm not a doctor. You're the doctor, right? I mean, just from a medical, from a scientific perspective in terms of how to stop the spread of this, of COVID-19, is that not what needs to be done? Just from your medical point of view? Absolutely.
I think, we know for sure masks work, distancing works, washing your hands work. We've seen in the places where more strict measures have been put in place, the cases go down, right? This is fact that we see that's out there. So I think it's pretty clear that's what needs to happen, and it's just not happening. I know there's lots of impact when you do close things down further, but I think we need to be looking at how do we mitigate those impacts, because we need our healthcare system to function, and it's not. It's so close to the breaking point, and in some places it's already broken.
Tell me about that. Tell me what's happening in the healthcare system in Saskatchewan.
So we heard today that we have the highest number of patients in hospital with COVID that we've had yet in the pandemic. So that's a really scary thing. We have over 200 patients in the hospital in the province. It's remembering, comparing to Ontario, we have a much smaller province, right? Yeah. So that is a huge number of people that are in the hospital. We know that hospitalizations and ICU admissions lag behind what we're seeing in cases. So if we see a spike in cases, it'll take a little bit to see that the hospital system is going to be stretched further. To manage it, we've had to close down other services so that we can redirect healthcare resources, whether it's space, equipment, or personnel and staff to take care of these patients. So we can't do the same job that we would normally be doing. And so other people suffer as well, right? In Saskatoon, there have been already a couple of times in the pandemic where our ICU has been so full that we've had to redirect patients to other ICUs in the province as long as they don't need a service that is only available in Saskatoon. That's already happened more than once in the pandemic.
And I mean, Saskatchewan, I suspect, is probably getting near to where Ontario is getting, which is that at some point, physicians are going to have to make some life and death decisions in terms of ICUs.
It's a scary thought, isn't it? It's not something I ever thought that we would be in a place to do anywhere in Canada, to be making decisions like that.
Yeah. What about vaccines? How are you feeling about... You know what? I'm going to ask you about vaccines at the end, because I'd like to try and end on something positive. How concerned are you about new variants? I know that there have been variants in different provinces in the country. I don't believe we know officially of the variants arriving in Saskatchewan, but are you concerned about them?
I think we all have to be, right? This virus has been already shown to be have such an impact on our healthcare system and on people's lives. And so I think we all need to be very aware of the variants that are there and do everything we can to be studying them and to be watching for them and trying to identify them, which I know everyone is doing. But I mean, for sure, it's worrisome.
And what about vaccines? Are you hopeful? Are they too slow? What's your sense of the rollout?
So very hopeful. Can't wait to get my phone call to be able to go. Absolutely. I think Scott Livingston and Derek Miller spoke a little bit today about the initial start was a bit slow, but that they've ramped up and they have plans to try and keep that speed going. And I hope that does occur, and that we get everyone vaccinated as soon as possible.
You are a pediatrician. Tell me about the kids. You know, we're having some very serious, difficult conversations. I mean, a lot of adults are pretty kind of down these days about all of this. What do you say to the kids, or what are you thinking?
I'm worried about them.
Yeah.
I'm very worried about them. I think all of us are seeing huge increase in mental health concerns in children. Way more kids admitted to hospital, more of our outpatient practices, our children are suffering. And it's heartbreaking to see how much they're suffering. I think we need to do our best to try and keep them as well as possible. So doing whatever we can to keep everyone safe, keep schools open if we can, as long as possible, but making sure that it's safe to do so that they do have some normalcy. But they're not okay. You know, people think about them in a different way. It's not COVID itself, it's the effects of COVID, right? And I know lots of people say, oh, the lockdowns or the shutdowns and the restrictions are what's causing everyone to be unwell. Our children are adults who are suffering with mental health concerns, and that's true. But we need the lockdowns or the restrictions to manage COVID, right? So the only way we can really get through this and get to a better place is if we get rid of COVID or decrease COVID, which means we need the restrictions in place so that we can decrease COVID and allow us to be able to handle all of the rest of the health that is suffering, right?
Yeah.
So hopefully we can find ways to balance that with the economy, support people financially so that they can afford to be home if we need to lock things down.
Dr. Kurji, I really appreciate your time today. Thank you very much. That's Dr. Ayisha Kurji, a pediatrician and an assistant professor at the University of Saskatchewan College of Medicine.